Hey everyone, how you doing? In this video, let's look at the most cost-effective way to get a full set of implants and a full set of teeth. So my name's Gus. I'm a cosmetic and implant dentist based near London in the UK, and we offer pretty much high-end treatment. Okay, so we don't cut corners. We're not trying to be the cheapest, but we do want to be the best. Okay, we're always striving to do better. Now, the problem is when you strive to be the best, what's going to happen is the cost to the end user, i.e. our patients, is always going to increase because we're doing more and more to improve patient safety. We've got more and more regulation. All of this kind of stuff all adds up into the end cost. Okay, so if you look at my website and the cost for one implant and then you shop around, you'll realize that the implants at our practice are more expensive because we're doing more stuff to make sure that every single one of our patients gets the best outcome. Problem is this pushes a lot of treatments out of range for a lot of people. So if you're on a budget, let's say £5,000 to £7,000, and you want to get a full set of implants, what can you do? And the good news is there is a really good solution to do this, and it's using mini implants, and it is a removable option. And don't switch off just yet, because whenever I say removable option, the first thing that comes into someone's mind is they're out to dinner and they're just having a talk and suddenly their teeth fall out. Okay, it is ultimate embarrassment. But what I'm talking about is implant stabilized dentures. So you've got a full set of teeth. They look amazing because we know how to position teeth and provide the correct kind of lip support. They should look very natural. But we've got these connections on the inside which really strongly click this denture in position. Okay, so typically we'll have between 4 and 6 mini implants with this connection across a full arch. Okay, so we usually 6 at the top, 4 at the bottom. And inside the denture, there's these housings with little plastic clips inside them. And these housings can be changed. There's different tightnesses depending on what the patient finds comfortable. Okay, and I've never used the tightest housing to this day. So to remove these teeth, even though they're removable, it's not easy. You can see, I've got a couple of patients and they're literally struggling to take this thing out. It does loosen up a little bit over time. When it's fresh, it's very tight, but then you kind of get used to it and you find the best way to remove it. The one thing is it's never going to fall out just by itself. And let's say you're in a situation where you've got a full denture, full top and bottom denture, and you're kind of happy with the way that it looks. You just want to stabilize it. You want it to just stick in and not fall out by itself. You don't want to use glues and things like that. Then you can actually have mini implants placed and retrospectively fit the denture into these mini implants. Okay, so it's the most cost-effective way to have a full set of teeth on implants. I hope you found this useful, and it looks like my daughter's joining us for the ending of this video. All right, guys, until next time, take care.